Chairman Neal, Ranking Member Brady, thank you for this opportunity to testify at today's Ways and Means Member Day. I know your committee receives many requests and your consideration is greatly appreciated. First, I'd like to highlight a serious issue for rural hospitals in my district. As you all know, rural hospitals are usually the first or second largest employers in small communities and often the only provider of health care. Across the country, however, they are currently experiencing a crisis, with more than 90 rural hospital closings since 2010. One way to help keep the doors open is Medicare Volume Decrease Adjustment Payments, or VDA. VDA payments help rural hospitals maintain core staff and services when a hospital experiences a significant decrease in patient volume. Unfortunately, rural hospitals in upstate New York are facing a bureaucratic mess over VDA. In good faith, 4 hospitals in my district applied for VDA payments, were determined to meet all requirements to qualify, and were awarded the funds. However, new VDA calculation instructions from CMS required a review of all VDA calculations made since 2013. As a result, 16 small rural hospitals in New York have faced recoupments totaling $20 million with a punitive interest rate of over 9%. CMS fixed this issue on a go-forward basis in 2017. However, the hospitals already negatively impacted by the flawed VDA calculation have seen no relief. I have proposed a legislative text here today that would provide CMS with the authority to try and fix this mess. This has bipartisan support from the upstate New York delegation and would help preserve access to care in rural New York. I hope to receive a commitment from this committee to work with my office to fix this issue. I would also like to briefly touch on the rising cost of health care in general. I appreciate the work that Chairman Neal and the committee have done to put forward solutions to stabilize our health care system. I encourage the committee to also work to ease burdensome taxes, including the health insurance tax, or HIT. I have introduced, along with Congressman Marchant, the bipartisan Jobs and Premium Protection Act to permanently repeal the HIT. As you all know, under current law, the HIT is scheduled to return in 2020 with an even higher annual rate. Health insurance carriers will take this tax into consideration when pricing their premiums. I've heard from insurers in New York that premiums would be 4 to 5% higher with the HIT. While I understand the budget confines this committee operates in, I ask consideration of legislation to repeal this tax. Short of a full repeal, I would also support delaying the tax to help small businesses immediately. I will submit my full statement for the record, which includes additional background. Thank you for your consideration, and I'm happy to answer any questions the committee may have.